Florida Medical Clinic offers well-rounded care for all of its patients at each of its many locations. In this next section of Health Matters, we're going to sit down and speak with Dr. Gray and learn more about his specialty, which is in upper body extremities and hand surgery. Dr. Gray, tell us what you do as a surgeon.
I trained in orthopedic surgery, and I spent 5 years learning how to be an orthopedic surgeon. And then I went to a fellowship program after the 5 years of orthopedic surgery. And the fellowship program focuses on an area that you have great interest in. For me, it happened to be hand and upper extremity surgery. And so I spent a year practicing with 4 other orthopedic surgeons who do nothing but hand and upper extremity surgery to learn sort of these subspecialty aspects, the intricacies of something that is a little more complex.
Being that you do specialize and do a lot of surgeries on hands, your hands are very visible. So I'm guessing that many of your patients come to you wanting a small incision, a less visible scar, etc. How do you get around that?
Well, it's interesting you start off in the cosmetic appearance of these kinds of things, because it is a consideration, but our overwhelming consideration is, are we making the right diagnosis? Have we determined what is the correct cause of their pain, which is typically what we're treating? And how do we best address that, being able to see it, visualize it, reach it, repair it, reconstruct it? And it's a very, very tertiary concern as to what sort of scar are they going to get out of this, because the primary concern is getting it repaired correctly and relieving their pain. But along those lines, there has been quite a revolution in orthopedic surgery with the advent of arthroscopy. Arthroscopy allows us to visualize joints internally through relatively small incisions and relatively minimally invasive aspects. And sometimes we are able to do the entire surgery arthroscopically through these small incisions. And sometimes these small incisions in arthroscopy will allow us to reach a better diagnosis of the problem and better locate our incisions, so our incisions may be smaller, and the amount of exposure that may require may then be smaller, because we've looked first with our arthroscope to know exactly where we need to be with our incision.
And I've learned that this surgery involves water. I didn't know that.
It is interesting that so much of the public is very aware that arthroscopy exists, and they come in and they talk to you for 20 minutes about an operation, and at the end of the operation they will look at you and say, well, is this done arthroscopically? So I no longer have to introduce arthroscopy to patients, but I do still have to explain arthroscopy to patients, because there are no open spaces in your body. There is no room for us just to put something inside you and start to go to work. So we have to create that space. And one of the ways that we create space in orthopedics and your joints is by the use of a fluid pump. So we have a saltwater pump, and it actually is introduced into the joint and it expands the joint. We then usually have an assistant for our larger joints to help apply some manual traction to pull on you, and that opens these joints and expands or stretches these joints, which allows us to put instruments inside the joint and work from inside the joint without having made an incision.
Interesting. Now, besides someone who comes to you for a trauma to their hands or to their upper body, is there one particular kind of patient that you see more often than not?
One of the more interesting things that we do that incorporates arthroscopy is wrist ligament injuries. There are many bones of your wrist, at least 8, and every one of these bones has 3 or 4 ligaments that connects them to the bone next door. And those kinds of injuries that frequently are felt to be a sprain but just don't get better. It's going to get better, it's going to get better, it's going to get better. And weeks or months go by before they finally come to see you and say, well, I have this pain in my wrist. It's been there a long time, but I was sure it would get better. And many of these happen to be these kinds of wrist ligament tears. And untreated, they frequently do go on to develop arthritis and secondary problems later in life. And so identifying them earlier rather than later and addressing them earlier rather than later hopefully can restore the joint congruity and prevent the development of arthritis from these sorts of problems. So arthroscopy is very powerful in its ability to help us with diagnosis and with treatment of many conditions.
And lastly, has there been any improvements or any medical advances to dealing with arthritis, specifically in your hands?
In terms of what we do, what we started this conversation about wrist arthroscopy, of course, there is even diagnostic joint arthroscopy of very small joints like your thumb or your fingers. We are not at a stage where we are able to do much surgically with these very small joints, but we have scopes that are not much larger than needles that you can put in, and you can make diagnoses based on these kinds of things. But not the technology yet to really operate or do something other than diagnostic. With wrist arthroscopy, your wrist is large enough that we have developed instruments that we can now do certain numbers of wrist procedures arthroscopically.
If you'd like some more information on Dr. Gray or any of the other many physicians at Florida Medical Clinic, just go to their website at floridamedicalclinic.com.